I'd like to welcome up Mr. Joe Bloom here, product manager at Jamf for Jamf Pro. He's got the best beard in the company. And we're going to be talking about transforming healthcare with Apple and Jamf Pro. Thanks, Joe.
Thank you, Nick. I'm Joe Bloom. Thank you for being here. I want to just quickly walk through what our agenda is going to look like today. I'm going to start by talking about humanizing technology because I really think it's important to understand the why of what we're doing. Later in the presentation, I'll show you the actual how of what we're doing. So I'll walk through the patient bedside workflow so you can get a lot of that detail. But I think the why is really core to Jamf, so it's important to talk about that. I'm also going to talk just a little bit about Apple TV management, clinical communications, because you've probably heard some of the stories about what we're doing with inpatient care, but there's a lot of really valid healthcare use cases. And so we're trying to tackle all of those meaningful problems that we can tackle because of the power of Jamf. And to continue on that theme, Jamf can't do it on our own. We know that you need Jamf, you need Apple, and you need that entire ecosystem. So we're there to help you break down those barriers and really make the Apple platform sing and be a part of that experience. And then I'll wrap things up by talking about integrated solutions, because that is really what the power of Jamf and is all about. So I want to start by talking about the why. So our purpose is empowering people with technology that puts humans first. You'll hear us say that a lot. And again, in Dean's words, what that really means, the simplified version, is we want to make people powerful. In the healthcare space, that's really important. It's very rare, I think, for a software company to have software that changes lives in the way that we're able to change lives in healthcare. A lot of times you're very removed from some of the processes that really do change the world and solve those problems that can transform experiences. So for Jamf and our purpose, this really resonates really strongly with us because it allows us to do just that, to empower the caregiver and to empower the patient. And of course, it also is in alignment with our mission of helping organizations succeed with Apple, because it's the Apple ecosystem that we're really trying to enhance and allow everybody to experience and unlock, right? So it's easy to say, oh, put an iPad into the hands of a patient, to go off of that example. Well, it sounds really easy, but we know that there's barriers to something that sounds so simple. How do you protect personally identifiable information, protected health information? How do you ensure that that device is secured? How do you make sure that your caregivers are not suddenly IT? We want to make sure that we preserve all of those things. And so a lot of the problems that people try to solve to allow that iPad to do what it does in the room, those are the kinds of things that Jamf and all those other providers can help with. Now, I'll give you a couple of examples. You'll hear people talk about the iPad as a distraction device. And I believe in that. I believe that it does have the power, particularly with children, to serve as a distraction when it's difficult to administer care and you need to do something to allow the caregiver to do what they need to do. Something as simple as giving that iPad to a child can allow that to happen, and it breaks down some barriers to care. Very important. Now, I like to think of it sort of as a pacifier. It's a distraction device, yes, but it's a pacifier. It brings that down. And I'm very curious to see where some of the research studies go that are currently looking at what that really means in terms of soothing and pacifying somebody by providing a device instead of by providing medication. There's good research going on that will show what that looks like and compare those two so we can really understand, yes, giving an iPad to somebody seems so simple, but it has this wonderful effect on care. The other example I'll give to the why is a personal example. My father just had heart surgery, and it was successful. But in the process of doing a heart surgery for my father, I got to see what my parents went through in their experience, where they had a schedule, but that schedule was changing on a regular basis, where they had other instructions and information about what was going on with the condition of my father. And these were things that they were able to get, but they didn't have a device that had the kinds of technology that could give them real-time information when their schedule would change, when their care plan would change, so that they were informed. And the thing that my father was most nervous about wasn't really the surgery, it was the uncertainty. So breaking that down is really important, and that's what Jamf can do when we allow that iPad, that iPhone, into the caregiving environment. So I will talk about the how, but I really want to emphasize the why. Now, as we look at some of the how, I'll talk first now about the patient experience. Really what we look at is what makes a good bedside experience. So we want the devices to be easy to set up so that, again, the caregiver doesn't have to take a lot of the onus on themselves. We have to make sure that it's secure. We, again, because of the Apple ecosystem, can provide the education, the engagement, the entertainment by allowing them to have the apps that they need on the device that they need and are comfortable with. We can also integrate and do things with patient surveys so that you get more information about the patient on a regular basis. All goes towards providing, again, better care. And then at the end of the experience, one of the core things that we did to help this entire process is take the time away from having to wipe that device, reconfigure that device, and get it ready for the next patient. So you've heard some numbers earlier today. I believe the Bungie number was about 120-something patients that they have helped. In the Jacobs Medical scenario, you heard that in the first 6 months, over 9,100 patients went through their 245-bed facility. And that's how many lives we've been able to touch so far. But the other thing that you'll note, Bungie said very specifically with iPads for kids, they want to get into every children's hospital. That is amazing to think about the kind of care that can be provided to children, the kinds of care that allow them to basically not have any blockers and be entertained and engaged and educated about what's going on, but it's also for their parents and family while they're staying. Now, the digital sterilization is important because, again, we have to allow the caregiver to give care and not perform IT functions. So I'll walk through a little bit of what this means in terms of Jamf Pro's role in this, right? We play a kind of a core fundamental role in making sure the device is configured. So some of the things we can do, we can set the wallpaper. Now, you might have multiple devices for various purposes. You might have an iPad that a nurse is using and you want to distinguish it. Pushing down the wallpaper so that it has information on it can be just one of those visual cues to understand the nature of the device. The other thing that we do is, of course, deliver apps. So what are the core apps that you need? Make sure you get those core apps for the end user onto that device right away. And then we have our self-service portal as well that allows you to expose additional applications. Part of this configuration also is hiding some of the unwanted apps. Make sure that that device really only has the things that they need to be successful. And these third-party apps, we'll show some of them, but it's like 3D for Medical. That's a really good educational tool. It's things like Tonic that do surveys. It's things like Epic MyChart Bedside that allow the patient to understand their care plan. The other thing that you can do is you can push down web clips. So if you've got other websites that have information that you want the patient to have, you can do that. Whether that's something like, hey, learn more about our hospital, and redirect them to a page that tells them about their experience while they're there, or other information that they might need. And then ultimately, you can define this entire experience by configuring the layout so that this is going to be a repeated experience. Every time you set up a patient, they get the device and it looks like this. That repeatability is very important. So these are all of the things that we talk about in the total experience. I think I skipped a slide here. Let me go back. We tie in with electronic medical record data through the Epic MyChart Bedside app. We have room controls, and I'll show you that. That's the Crestron app. Of course, this is important for clinical communication and also communication for the patient with family who might not be on site so that they can stay in touch. We show the surveys here through Tonic. And of course, there's entertainment apps like Hulu and Netflix, and the educational piece where key apps can provide that additional information for the patient. Now, the process itself looks like this. When a patient checks in, they're going to be given an iPad, and that's a clean iPad that they can set up. They go through the setup assistant and personalize this so that it's in the language that they need. And then in most cases, what we've seen is that there's a specific dedicated Wi-Fi for these devices so that you know that all the patient devices are on that specific Wi-Fi. After that point where the device is connected, we take control, and Jamf will configure that device to look exactly like you need it. So here you're seeing some applications being pushed down, the wallpaper being pushed down, and we've configured the screen specifically for that use case. Then we get into the core apps. Now, the core apps are important because there's going to be certain things that really drive home the value of what you're trying to accomplish. And the MyChart Bedside app is an excellent example of that. In the setup process, the nurse scans a barcode, and that maps the app to the patient, and now they've got access to all of the information that is tied to them and their stay. This is great because this allows you to have access to personal medical information about what's going on. You also get your daily schedule. So those scheduling changes that I was mentioning that sometimes change through the course of a day, they would be able to see that schedule on a regular basis. As well, they get to know their care team. That can be very important in establishing trust and making a patient feel very comfortable in their environment. They, of course, have access to detailed health information, and they can always get more information through this app. One really good example of a core app that delivers real value to the patient and also makes it easier for the caregiver. Next in the patient experience, I want to talk about something that's unique to Jacobs Medical Center, and that's the room controls. So Crestron provided an iOS application, and they worked with Jamf to do app configuration of that to customize it every time we push that app down to the device. What this means is that when we push this app to the device, it's configured specifically for that room. If you think about a one-to-one deployment of a device to a user, it's the same scenario, but it's one-to-one device to room. Now, if you don't do that, that's still okay. If you're getting the device in the hands of a patient, that's a wonderful thing and it has a lot of benefits. If you tie it to the room, it allows you to extend that out and give them additional functionality. This is the kind of thing that if you're not in healthcare, but you're in something like hospitality, is also applicable, where you have this room experience, and you want it to be really custom, but you want it to integrate with all the other things. So with the Crestron app, what they're able to do is change some of the lights. They can do things like move the blinds. They can do climate control. And they can even control the Apple TV. And because, again, Jamf is managing these devices and configuring the application, that device that's talking to the TV is pre-configured to work with that TV. Small thing, but again, you can't have somebody accidentally streaming something or showing something on another device in another room. So from a security standpoint, very important, but also just part of that holistic experience for the patient. The other piece that I mentioned is self-service. So there's core applications that you will want to probably provide to your patient, but then there's other applications that you can make available. Self-service offers you that opportunity to categorize those in meaningful ways so that they can find additional applications. So here we're seeing Hulu, we're seeing the gaming apps and those kinds of things that you can push down. What's nice about this is that the hospital gets to choose the applications to use. The patient gets to choose what they want to install, as opposed to eating up bandwidth and installing everything right away. And it's all installed automatically when they select it, and there's no Apple ID required. So again, trying to just break down the barriers and put the control in the hands of the end user. It's similar to what we said before with self-service, where self-service really is that I want to help myself. Just give me a tool at my fingertips to have a better experience. Now, the key piece of this, again, is what happens when they leave the hospital. How do you protect the personally identifiable information, the protected health information? And that's where we've done some additional work. The power of Jamf and is the ability to tie into Epic's electronic medical record system. Now, it doesn't have to be Epic, because the way that we built this is on the HL7 protocol. So all you have to do is send us that information about, in this case, a transfer or a discharge is what Jacobs Medical used. And that was a signal to us saying the patient's going to leave the room. You should wipe that device. Now, from a caregiver standpoint, what that means is they don't have to take any additional action at that point. They're following their normal workflow. And from a sanitation control standpoint, it means that when they go into the room to make it ready for the next patient, all they have to do is use a cami wipe and wipe down that device. There's other barriers that come up in healthcare conversations, and sometimes that's around cases, for example. It's up to you if you want to use a case for the iPad, but there's really good solutions if you're looking for one that can meet those needs and the sanitation controls that you would need to have in place. And they offer a lot of unique functionality. So there's some cases that would allow you to lock it into a dock, use a PIN code to remove it. There's other cases that, again, can be mounted in different ways. So look for solutions, but they're out there. That doesn't have to be a problem in this whole workflow. Now, when the patient's discharged, we have that healthcare listener component that's tied into the electronic medical record system. And all we're really doing is waiting for a signal that says, hey, this is the room and this is the action. From a data standpoint and security of data, the healthcare listener would sit wherever you want it, but of course, usually it's deep inside of your firewall. And that information doesn't leave that ecosystem. All it does is make an API call into Jamf Pro and says, do this thing to this room, and then we wipe it. So very simple. We've extended this over time. So in addition to being able to digitally wipe a device, you could also set up rules with Jamf Pro to do things like put it into lost mode. So if you're in a facility where an accidental discharge might be a possibility, you could say, well, if there's a discharge, put this device into lost mode. We don't want anybody to use it. We want it secured and locked down. And then when a patient's admitted into that room, you know that whoever was in there before is actually gone, and then you could trigger a wipe command. There's different ways that you could set this up. So if accidental discharge is something you need to worry about, you can use the rules that we've implemented to work around that. Otherwise, if there's a discharge or a transfer, go ahead and trigger the wipe action. Now here's how this works at a little bit deeper level. So the patient comes in. We've got the device being set up. There's an admit action. We are actually listening for that patient admit. And if you have a rule for that to do something to a device, we'll do that. We enroll that device because, again, when you reset a device, remember, it's now not managed. Until they set it up and it does the device enrollment program workflow, it's an unmanaged device. But the beauty of the device enrollment program is that all of these iPads will automatically enroll in Jamf every time for a repeated experience. At that point, the device is configured with the patient check-in. We start that bedside experience of configuring the device, pushing down all those apps that we need, pushing down profiles that would maybe lock them into the specific Wi-Fi network, distributing the apps, making that a secured device. So do you want to turn off the camera, for example? You can disable the camera, everything consistently every time with Jamf. And then we have that discharge action. And in this case, that's where we receive the ADT AO3 message for a patient discharge, and we trigger that wipe of the device. It's ready to go on to the next step. So overall, what we've tried to do here is make this really simple for the patient. We want to make sure that we're protecting all of the data that is traveling through that ecosystem, being one of the main things. And of course, in past years, healthcare and that industry has been a major target for security breaches as well. So we know that that's very important. And ultimately, we want to make it simple for the hospital IT and care teams so they're not doing very much. Now, a couple other talking points on this before I move on. In the case of Jacobs Medical, they used volunteers as part of the IT support. So if a patient wasn't terribly familiar with how to use an iPad, they had volunteers on staff to help with that, again, saving them IT hours. A very nice way of addressing that other problem of how do you make sure that somebody's aware of how to use and leverage the power of that device. The other thing that I want to talk about then is TV management. So Apple TVs are now fully manageable by Jamf, and they are honestly the easiest to set up because all you do is plug them in, connect them to Ethernet, and we can walk them through the entire setup experience. What's great about this and how it relates to healthcare is that you can actually, with the new changes we've made to the healthcare listener, automatically wipe and reset that TV as well. So what can we do with an Apple TV? It's the zero-touch setup. It's over-the-air configuration of that TV, deploying any enterprise apps, some of those remote commands that you'd want, and tvOS restrictions. But again, because we have the iPad and the TV, if you happen to have both, we can map those together. So now you've got an iPad and a TV that can work together very seamlessly. The other thing that we do here, again, Apple TV and iOS pairing. So this is similar to what was done in Jacobs Medical Center, but they actually had the Crestron app doing a lot of the controls, and we would sync down to the iPad how it connects. There's a lot of different ways you can configure this, and if you just have a TV in the room to start with before there's an iPad in the room, you can still accomplish some of the personalization and protection through the healthcare listener to wipe that device. The other thing I'll note about this is that should for some reason a wipe action fail, we do have alerts on those. So a good example, the iPad ran out of battery power. For some reason it wasn't plugged in. We'll send an alert just to say, hey, we tried to wipe this device. We tried to remove PII and PHI, and we weren't able to. Go check the device in that room and see why that's the case. Did it drop from the Wi-Fi network? Does it have a dead battery? All very simple things. But again, if we accomplish all of those things and we inform and alert you, you can have that seamless process without having to step in every time. So IT can be IT, caregivers can be caregivers. The next thing I want to talk about is enhancing the delivery of care. So this is the clinical communications side of what we do. And there's a number of providers that really enhance that experience when you're talking about things like iPhones and Apple Watches in terms of the notifications and the ways that you can communicate securely. So I just want to point out some of the things that are a factor in this particular world, and then I'll point out a couple of the Jamf and providers that you might want to be aware of. So secure communications is one. Of course, all the alerts and alarms, whether that's on the phone or that's tied into the Apple Watch, as you saw earlier in the opening with Simplify. We've got the bedside vitals and the Epic Rover app, so things that will contribute to rounding activities. We've got documentation needs and ways of filtering that information, and then the administration of medication as well. So all of these are things, again, in the Apple iOS ecosystem, there are app providers that are there to support you so you can get more than the common denominator. When you look at a standard device today that's not an iOS device, it sets a very low barrier to entry. It just does fundamental things, and those are very important things, so I don't want to discount that. But again, when you have an iPhone, it unlocks a lot of potential of giving better care. So some of the solutions to be aware of, MHCure by Mobile Heartbeat for unified communications, patient-centric collaboration, role-based workflows. Patient Touch from Patient Safe Solutions, so good clinical communications platform, clinical workflows, and coordinated care. And then one that I want to spend a little bit more time on, which is from Infinite Peripherals, and they do have a booth in our exhibitor hall, so please stop by if you haven't yet. But they have a sled. This is the device that the iPhone is mounted into, and that particular sled has a battery backup, which ensures that that device can be used throughout the day without having to worry, and you can flip that battery pack in and out. Works exclusively with iPhones, provides LED alerts, and it has a barcode scanner as well for a lot of those activities. Now, what makes this unique and why I want to spend a little bit more time on it is that IQ from Infinite Peripherals provides some peripheral device management capabilities. And we've recently released, because of development by Infinite Peripherals, an integration between that solution and Jamf Pro to get better tied-in inventory management. So I'll show you briefly what this looks like. I know this is a little bit difficult to see, but essentially when you have the sled itself that the iPhone is in, it has a number of pieces of data on that. Some things that are more technical, like what's the firmware that's on that device. But it also does things like show you the battery power and other important pieces of information about the sled itself. What makes what we've done very unique compared to some of the other integrations is that we've actually mapped that data from the sled specifically to the iPhone that's inside of it. And we've exposed all of that information through extension attributes into Jamf Pro. So if you're wondering about a device, whether it's a sled or an iPhone, you can go into Jamf Pro, you can scope to that phone, and now you know this iPhone is mapped to this sled. And here are some of the statistics and important information about that sled. This is a first step in this integration, but it's a very important one because now you've got more information at your fingertips in a centralized place, and if you need to take action on that, you can do so and you're well informed. So a really elegant solution, and again, they're in the exhibitor hall. If you haven't seen that yet, please do so. There's a lot that we can do when we start thinking about the iPhone and the sled workflows, right? So what we want, again, is that seamless experience. The same way we did it for patients in inpatient care, we're looking for ways to provide a seamless iPhone experience inside of the facility so that caregivers can do handoffs between devices and manage and round and not have to worry about some of the IT-related issues that might arise. So we're continuing to look at the core problems that we can focus on in that area. There's other things that I'll note when we talk a little bit about integrated solutions. So we've touched on a couple of use cases. We've talked about patient bedside. We've talked a little bit then about the clinical communications workflows, but there's also things like the check-in experience, right, where you might want to put an iPad in single app mode, push down an application, something like a Tonic app. Those are all things that you can do today. Waiting room experience is another one where you might have people in the waiting room where you want to provide a device and put some management down on those devices. There's also things like carts that move throughout the facility that are required for translation. And so what are the ways that you can enhance that experience? There's any number of things that you can do. And there's a number of app providers in that ecosystem that can help you. Many of those I've talked about already, the 3D for Medicals, the Tonics, the Epic Rover, Epic MyChart Bedside. So look for those solutions because they will help enhance and unlock, again, all the potential of Jamf and, which is really Jamf and Apple and all of the providers that are making this possible for healthcare. Now, on the integration side, again, it just bears repeating. How have we done a lot of what we've done? Well, we've leveraged our APIs. Our healthcare listener is something that we built, but it uses our API to parse HL7 data and automate that workflow. I talked in the keynote originally about how when you look at the power of Jamf and, another one is just data sharing and how that can be very, very powerful. And that's very similar to what we're doing right now as a first step with Infinite Peripherals and getting that SLED information in. The app config is a really important piece because without the ability to push the Crestron app down and configure it, we wouldn't have that same holistic room experience. This is all possible because of what Apple has done with the app config community, with Jamf, and of course then with all of the providers that are out there that make the ecosystem. The other two things that I'll point out, we've mentioned them in other sessions, the developer portal. That is our API documentation and reference guide. It shows how to do this. So if anyone happens to be watching and they're an integrator or somebody who develops solutions, that's a really good way of understanding what you can do and what kinds of automated workflows you can create. And we also have the Jamf Marketplace, where you'll be able to find some of the integrations that we're putting out there that can help make the healthcare experience a better experience for everybody. So thank you very much. We'll open it up for questions, assuming that we have time. But again, I want to thank you all for coming. And as we look at some of the hows, I mainly want you to know that while the how is important, the why is obviously what drives everything. And ultimately, I don't want you to have to worry about the how, because if you're worrying about the how, we haven't done our part to make the how go away. A lot of what I just showed you are problems that we've been able to solve with Jamf and all of our partners, and that means you don't have to worry about the how. Just let us help you focus on the why.
Awesome. Round of applause for Joe. So we have a couple of minutes for some questions and answers. We've got 2 microphones set up there. So if you have any questions, please go to them. While folks may be making their way there, I've got a question for you. Okay. So tell us, how long have we had this healthcare listener, and how have we evolved it over the past couple of years?
Very good question. So it started really as a prototype that we worked with UC San Diego and their team for Jacobs Medical Center. And it started out very simplistically as we were listening to an admit, or sorry, not an admit, we were listening to a discharge or a transfer, and that would wipe a device. As we started to learn more about other facilities and their needs and grow the people who were adopting it, we knew that we needed additional workflows. So then we started doing rules, and now you can go up and you can set up a rule. So you would say, okay, this is the ADT message I'm listening for, admit, transfer, discharge, room swap, those kinds of things. And when those would happen, you can set up the action that you want. And we've kept it pretty basic to things like wiping, lost mode, remove from lost mode, because there's not that many really good use cases for the kinds of actions you need to take. I mean, ultimately, the device is configured for the room, so the most important thing is what happens when the nature of the room changes, you know, when the patient changes, and what do we have to do for that scenario.
Awesome.
Then recently was the tvOS management and the ability to wipe TVs. So there have been facilities that we've talked to that their first step was to put an Apple TV into the room. And as part of that workflow, again, they can do that wiping and have it be a more personalized experience.
Looks like we've got a question over here, please.
Hi, my name is Winston. I'm curious to know, I heard someone talk about the ability to use, let's say in the scenario, the patient's Apple ID on a device, right? So then when it gets to the point where the patient checks out, I'm guessing they get that notifier, ADT, if I'm saying the right thing, whatever they say, hey, they're gone, it wipes itself. For the iPad to wipe itself and get back up to a point of what am I doing now, that's all controlled by Jamf, right?
So good question. A couple things to note. So one is the wiping of the device absolutely is done by Jamf. But to backtrack from that, Jamf would issue the wipe command to the device. If you back out of that, the reason that it's issuing the wipe is because the healthcare listener has told it to. And if you back out from that, it's because the healthcare listener received something from the electronic medical record system.
Right.
And if you back out from that, it's because somebody discharged the patient.
Right, okay.
Yeah, but that's the workflow. And we have looked at and addressed things like what happens if there's like a bypass lock and things like that. So there shouldn't be any real barriers to making sure that device is wiped, as long as, again, it's connected to Wi-Fi and has battery and all that. But we do alert if for some reason it doesn't work.
Okay, and is there any documentation or any kind of like a workflow or like a kind of like a setup? Because my organization is I'm heavily interested just because we have people that even have a hard time typing and configuring iPads.
Yep.
So the difference between an S.dot account and a regular account means it enrolls one way versus another. So put the device in the patient room and it doesn't do what it's supposed to do. It's pulling up some user's email that works at the organization, something stupid like that. So I just want to make sure that I can explain to someone who hasn't seen the presentation, hey, this is where I want to go with this, because then these devices will loop themselves instead of us having to come into the room and somebody type something every single time, which is total waste of time and money to me.
Yep.
So if there's anything out there, I'd be interested in seeing it or at least trying to get a hold of it.
Yeah, absolutely. If you hang around, I'll point at the people in the room that can help you, that are sitting right there. And then I also want to bring our photographer up on stage in case we have additional questions, because he happens to be one of the people who is excellent at going out and implementing as a Jamf SE these solutions. So this is Tim Knox. If you're in the healthcare space and you haven't met him yet and you're looking at doing some of these patient workflows, you'll probably get a chance to meet him.
And you should, I'm great. Wonderful. He's also great at photography too. Yeah. Do we have any other questions? Now's a great time to get some good answers.
Hey there. We're on your cloud. Is it possible to use the healthcare listener with a cloud instance?
I could answer that, but I'll let him since I brought him up on stage.
The short answer is yes, absolutely. Yeah, we can. We just need to be able to hit your Jamf cloud from the ADT thing that's sitting on the server. So that just needs 443 out, which most dang everything is.
Is there any additional security concerns?
The good news is that we parse all PHI out. It's like by the time it hits the HL7 listener, we don't see anything that would be HIPAA non-compliant or any of that stuff. We just need to know, is there a human in the room and what room is it? We don't want to know anything else beyond that. So there really shouldn't be any concern security-wise about what we're feeding out to Jamf Cloud.
Yeah, we run into a lot of, and I don't know if it's your case, but we run into a lot of people that will have like some kind of integration engine where you can customize what you're going to send to us as well. And so as part of that, you can pre-parse out the things that you don't want in the payload that we receive. But otherwise, everything that comes in, we make sure that there's no PHI or PII in that before we do the action.
Totes.
Thanks.
And then that's also just kind of read remove, right? So we don't want to store that kind of data. We make sure that's in your infrastructure, not ours.
Yeah, and I absolutely want to talk to the person who asked the first question about Apple IDs and stuff like that later. So like, hit me up after we're done. Cool. Any other questions is what he asked. Thanks, he said.
Hi there. I had heard that you had mentioned Epic specifically as the EMR. Do you work with any other EMRs for these specific instances?
I can
Or
take
will
that.
it?
Yeah, go for it. It's all yours.
Essentially, a lot of these projects started with Epic, just given its breadth in the market. But we're using an HL7 protocol. So if you're using Cerner, McKesson, as long as you have a way of sending us the HL7 feed to get us the data, you'll be fine. Now, I did call out a couple of Epic apps, like the MyChart Bedside and the Rover. Those are apps developed by them. But if you have other apps that meet that need and can provide the information that you need, whether that is for rounding activities for caregivers or for the patient care side, with the actual patient knowing about their medical records and schedule and those kinds of things. At that point, it's just a choice of what apps you have with the provider that you're using. We actually have some hospitals that have multiple, right? They've acquired or transitioned, and so you'll see multiple EMR systems in place. And that's what's nice about this. All you have to do is have an integration engine that can send us the data. That's all we need.
Yeah, I'm actually working with 2 customers that are, one's using Allscripts and one's using a homebrew that they just built themselves that has probably been running on a server, probably on Windows 95 since the Stone Age. But yeah, it's totally doable.
Yeah.
Okay. Thank you.
Great questions.
Last chance, going once, going twice. All right, well, everyone, thank you so much. We appreciate your time here. Give us some feedback in the app, and the next session here will be at 2:45 with Microsoft. Thanks, everyone.